All right, everybody. Hello, and welcome to part 3 of our Meaningful Change series, sponsored by our lead sponsor, Praxis Precision Medicine and Neurocrine Biosciences. My name is Casey Craig. For those of you that don't know me, I'm Stella's mom. She is a 5.5-year-old SCNAA warrior that's sweet, sassy, and fiercely strong as she battles with this disease along the side of your kiddos every single day. Today, I come to you not only as Stella's mom, but a Acute Syndrome Foundation volunteer and a fellow SCNAA parent that lives day in and day out with many of the same struggles and fears as each of you. Today is just us, the people who live and breathe SCNAA, and the only ones who can truly understand this life. Our goal for today is to have a non-judgmental, honest, and compassionate conversation, talking about the difficult decisions and situations we have faced and may yet face. So grab a coffee or a tea, curl up with your favorite blanket, and a box of tissues as we chat with 4 amazing SCNAA moms, Karen, Gail, Liz, and Heather, as they share their experiences on how we learned to make medical decisions in a crisis. Before we get started, just a few reminders. Group interaction through questions and/or comments will take place in the chat box. The chat box is to your right, and it allows you to type questions and/or responses for any of our Rockstar moms today. To your left, there's a tab titled Expo. In this area, you will find some troubleshooting if you're experiencing some technical issues, or you may also type a request in the help for help in the chat box. Our technical gurus, Megan Varner and Shelley Frappier, will help you tackle any technical issues you might have today. Just a friendly reminder to mark your calendars for next week, part 4 of our Meaningful Change series, how children with SCNAA utilize augmentative and alternate communication. You will hear from several SCNAA parents with children of varying severity of SCNAA on how their kids use different communication devices and their experiences on how it empowered their children to express themselves. You'll definitely not want to miss next week's conversation. Now, I would like to introduce our very own Hilary Savoy. She is the founder and director of the Acute Syndrome Foundation, and I'm so proud to be fighting along the side of such an amazing woman, mother, and friend. Without further ado, Ms. Hilary Savoy.
Hi, Casey. Can you hear me okay?
Yes, I can.
Thank you. Okay. Hi, everyone. Welcome again to Acute Syndrome Foundation's Meaningful Change series. As Casey said, today we will be discussing making medical decisions in a crisis. This series as a whole is focused on the ways in which the knowledge found within our SCNAA community can be leveraged to better support all of our children. We are an active community with a history of engaging deeply, meaningfully, and measurably among ourselves, as well as with the medical research and drug development communities. We all want to dig deeper into sharing the benefits of those experiences in as many ways as possible. And one of those ways is in sharing our stories with each other openly. I'm going to ask you all to permit me a few extra moments today to carefully set the tone for today's conversation. It's been a really difficult couple of weeks in our community as we face the losses of 2 children in a week. And in a lot of ways, I was worried about having this conversation right now. However, the more I thought about it, I thought about the all too real truth that children in our community face medical challenges that threaten their health and safety. We know this. We all know this. We know it logically as we daily face tough decisions for our children, but we also know it deeply in the pits of our stomachs. I know for many of us, the fear of a devastating medical crisis for our child is with us at all times, especially during weeks like this. I know this because I have talked with so many of you about it. Sometimes just the two of us in the midst of a crisis, or in calm, casual conversation, and sometimes in small groups, like during our book club, for example. And I know it because I live it. I want all of you to know that we are a non-judgmental community in which we can acknowledge, excuse me, and talk about the difficult decisions and situations we have faced, are facing, and may yet face. The idea here is to set a standard around open dialogue that is centered in the idea of empowering our families and respecting our children in honest, compassionate, and orienting conversation that is prescriptive only insofar as it creates space for informed decision making, not advice on specific choices. And that's helpful to people who learn and process information in different ways, as well as people of various belief systems. In this session, we're going to hear from 4 mothers in our community. Most, if not all, you know and likely know really well. They're going to talk about their experiences, what they saw, what they felt, and what they learned in a medical crisis, and what they want all of you to take away from those experiences. This is not because you will necessarily face the same or even similar situations, but it's because we want everyone in our community to know that they are never alone as they face life with SCN8A. Our experiences as a community, they hold us together. They offer us the chance to learn and plan in various ways, and to provide people to whom we can always turn. And with that, I'm going to invite Karen, Gail, Liz, and Heather. Please join me on screen. As they're joining us, I just want to say, as many of you do, I know these women as mothers and advocates and friends. And each of them, I know, are always there for you to turn to for support. Hi, Gail.
Hi.
See if we can get Karen and Liz. Oh, here's Liz. Hi, Liz.
Good morning.
There, hopefully. I know everyone, Heather was having some connectivity issues. So Megan is saying she is on her way. So hopefully we'll see her in a few. And while we're waiting for Heather to join us, why don't we go ahead and give you each the chance to introduce yourselves, just kind of who you are to the community, and just in case anyone here doesn't know who you are. I think everyone probably does, but Karen, why don't we start with you?
Hi guys, I'm Karen Varner. My daughter is Lily, who I talk about all the time. She is 23 years old. I am also a member of the executive committee for TCSF, and my focus is on family support. And today I'm going to focus mostly on signing a DNR, but also share the times that we didn't actually honor the DNR form.
Thank you, Karen. And Gail, could you just give us a little background on you and what brings you here?
Yes, I'm Gael Muller. Is Milo, and he's our first child, so you know it was a new experience for us for being needed. He has an SCN8, quite severe seizures, and he had a severe event that I will go through a little bit, experience and the takeaways from that. Yeah.
Thank you, Gail. And Liz, can you do a little introduction?
Hi, everybody. My name is Liz Ramirez. I am first and foremost Will's mom and a volunteer with the Acute Syndrome Foundation. I'm speaking today as a parent who lost her child to SCN8A. Will was 7.5 when he died suddenly of SUDEP, so I'll be kind of sharing his story and our story today.
Thank you, Liz. And Heather, do you want to just introduce yourself and tell us what you'll be talking about a bit today? Oh, Heather, you're still muted. Oh. Okay, it looks like maybe Heather's having a little bit of trouble. Heather, I guess you've taken your video off, which is probably good for connectivity. Do you want to try to unmute and see if you can introduce yourself? Okay. I think what we'll do, Heather, is I know you're having trouble. I'm sorry. And in 2021, we all are pretty much used to having this happen. So Heather, don't worry. And you are absolutely among friends, and we will make space if your connection gets better. Just let us know. Okay. So why don't we, first of all, I just want to thank all of you for coming on today. I know that these are really difficult conversations to have, and they're important conversations to have. So I want to, thank you all for being here. With that, maybe I can hand it off. We're going to tell some individual stories, and then we're going to have some discussion as a group and ask our parents who are watching to add their own questions kind of later on in the conversation. So with that, maybe Karen, would you like to get us started and talk a little bit about the experience that you're here to discuss with us today?
Sure. So I kind of I'm kind of glad I am going first, because I wanted to start out this conversation in saying that all the things that we're talking about today are very personal decisions. They are governed by our religious beliefs, our personal beliefs, our cultural beliefs, but there is no right or wrong with anything, any decision that you made. And no one should ever judge you for the decision you make, because you are making it in the best interest of your child. Also, in relation to DNRs are a piece of paper. And just because you sign it doesn't mean you are bound to it. And excuse me, I will list a couple of occasions where we kind of didn't follow through. Hillary is going to share some links after our session in relation to things that we're presenting today. But one thing that in the state of Tennessee, our DNR order is called a POST form, which stands for Physician's Orders for Scope of Treatment. And so she'll share a link. It is through the state of Tennessee, but if you Google your own states and countries, you should be able to come up with something similar. And there's also tells you a little bit about what they are. Basically, it is a checklist of the wishes that you want the doctors to perform on your child in a crisis situation. In our case, we have decided in a respiratory event, they can treat her with medications, they can treat her with cough assist and vest treatments and BiPAP or CPAP, but we will not intubate again. If it becomes a cardiac event, then we would give her medications. We would not do compressions or defibrillation on her. And this can also be used as an outpatient as well. So we keep it with her at all times. The first time that this discussion came up was about 4 years ago, and Lily was intubated for 4 weeks. And very first time my husband and I ever even thought about it. And we pretty quickly said no. At this point in time, Lily was bouncing back from seizures and health issues. And so we were like, no, we don't want this. What I regret is that after that hospital stay, we didn't further that discussion. It happened, we didn't talk about it, and that was it. And then 2 years ago, she was admitted again. And it wasn't a respiratory thing, but she was very sick. She had kind of gone downhill, and it was almost appeared like her body was shutting down. And the DNR was brought up again. And at this point in time, my husband and I did have a discussion, and ultimately we did sign a DNR. Thankfully, she left the hospital. But once again, we should have had further discussion outside of the hospital. Because we all know when you're in that crisis situation, you are bombarded with decisions every day and information, and you cannot process all that you've heard. And even though we made the decision, I don't think we truly accepted our decision. And 6 months later, we ended up back in the hospital, very, very sick. And we had rhinovirus, and we all know how rhinovirus affects our kids. And they had to intubate. And my head was telling me we've signed a DNR. My heart was telling me, that she was going to be okay. It was going to be short, no problem, she'll be fine. And so ultimately, we didn't follow through with the DNR. And I regret that. It was 6 weeks of hell. And she went through a lot those 6 weeks. And I regret that, because our children shouldn't have to suffer like that. So we ultimately signed the DNR. We were now in adult hospitals. We had transitioned. And at that point, we did process and we did accept our decision. Fast forward 4 months later, we're in the ER again, but this time for blood pressure, no respiratory events at all. And they gave her an antibiotic, and she had anaphylaxis. And when you have anaphylaxis, your airway closes. And so the first thing out of their mouth is, we need to intubate. And I immediately had flashbacks to 4 months earlier. And I thought, I can't do this again. I cannot put her through this again. And my husband and I talked, and I kept saying to the doctors, but we signed a DNR. We signed a DNR. I mean, they probably thought I was nuts. And finally, the doctor got in my face, and he's like, this is different. This is fixable. This is treatable. 48 hours max. Once the airway clears, we can extubate. 36 hours they did. And I know I regretted our decision 6 months or 4 months earlier. I did not regret this decision, because 2 days after we left the hospital, she stopped seizing for 6 weeks. And we had smiles for 6 weeks and giggles and wonderful. And that is the last time we had wonderful. We've had glimpses, but not those 6 weeks. And I am forever grateful for that doctor for doing that for us. So ultimately, signing a DNR is not easy, but signing it is easier than following through with what is written on it. And the only way to really follow through is to have multiple discussions and to accept that decision, and to continue having those discussions even after you sign it. Thank you.
Thank you, Karen. I so appreciate and value you sharing that story. And I think allowing for complexity in understanding, that these are decisions that are not made once, they're made often, as you are approaching an end of life kind of set of decisions, and that they need to be reevaluated, and that the ground is different, right, from one moment to the next, and you can't necessarily entirely predict that. And so I think that's a really helpful set of stories to understand. And I just want to also thank you for your leadership in this community, and Lily's leadership in this community as one of our oldest, I can't say kiddos, young women with SCNA-Day, who has paved the way for so many of our kids. So thank you for sharing that with us. And with that, I am going to ask Gail if you could talk a little bit about Milo and the experience that you wanted to share with us today.
Sure. So just a very quick background. Milo had his first seizure at 3.5 months. The seizures were quite severe, and we were playing with medications. They were getting further apart, but severe, they usually were clusters. And then in November last year, he had a cluster that was quite severe, and he had a cardiac arrest, which is considered witnessed because it began in the ER, which actually is a slightly better chance for survival, but it really is situational. It's always situational. And, at the time, you don't really fully process what's happening. It's happening very fast. And he actually had a pretty long cardiac arrest, 25 minutes, but it flies by. And the team asks you briefly if you know what's going on, but you're just not able to process. So you kind of just say, yeah, I think I know what's going on. And Milo was doing a lot better at the time. When he wasn't having seizures, he was making progress in therapy and giggled a lot, and he was much more aware. So we basically were just hoping he would just bounce back like he had done many times when we had to go to the ER. And they intubate him and they observe him for a couple days, and then we go home and everything's fine. But this time was different, and we didn't know that. In fact, when it happened, sorry, my husband even jumped in the shower when I was on my way in the ambulance, because we thought it was just like another time where we're going to be in the hospital for a few days. And so he just wanted to quickly shower since he may not be able to. And, I was by myself for the first part of the cardiac arrest, and he came very quickly. Thankfully, we're very close to the hospital. But that's something that I wanted to share, is it's really important to have this discussion with your partner in advance. First of all, in theory, even for a normal child, you could have a car accident or something. So it really should be, in theory, discussion you have no matter what. But especially for our kids who are much more at risk for these issues and risks, it's definitely really important to talk about it beforehand with your partner, so you know where each of you stand in case you have to make the decision yourself. You might be on the phone, but it's still much better to know in advance what you each hope for in these types of situations. And it can change. You can discuss something, and then in the moment things can change. The doctors might say, well, this, we think we can take care of it. And, it's really hard to know. I tried to look at recovery based on how long somebody has an arrest for. And although there's some trend that obviously the shorter the better, a short car arrest, recovery from a long cardiac arrest, it really just depends on the situation. So anyways, they saved Milo, but he's completely different now. He's not the old Milo. We kind of, in a sense, mourned the old Milo because, he's much, much different than he was. He's slowly making progress, but it's very apparent he's not going to come back the way that he was. And, you have to kind of accept it at some point. But, that's one of the main things is, there's no right or wrong answer. You're going to have a what if no matter what. We would have what ifs had we asked the team to stop doing compressions, and we still have what ifs. Maybe he'd be in a better spot now, resting peacefully, and not suffering like he does a lot today. And you feel kind of responsible since you make that decision on their behalf. So the other thing that I want to take, that I hope that everyone takes away from this, is that you should make the decision, it's hard as a parent, on your child's best interest, not necessarily yours. And it's very hard because you have like the pink glasses on when you're a parent. But you just have to check and kind of be honest with yourself. Is your child suffering every day? Is it, do you think they're going to recover in a sense that they'll be happy? And it's hard, especially Milo makes progress. So you think, oh, it's good that he's here, but he still has a lot of days where he's suffering. So the smiles are there and they make me feel better. And I'm sure he feels better in that moment. for hours a day. Of shape, he's crying right now. Someone's watching him though, but so that's the main thing. And also another big take home message is don't be afraid to be present in that moment. It's really hard, but you're not a bystander. You know, the ER team is busy and you can have a lot of people there, and obviously you don't want to bother them, but there's usually somebody that you can relay and who relays to you information. And, you know, I just kind of was in a moment of stupor, and I felt so dumb afterwards because I'm a scientist and I should know better biologically that what's going on. But it just goes to show in those situations that your mind is pretty blank. So having the discussions in advance, knowing that you can make decisions, actually, you could have a DNR and choose not to use it. You don't need a DNR to tell the team to stop trying to resuscitate, for example. And try to just be very aware of the situation. And when you ask the team, you know, what's the recovery at this point, they will always give you a vague, well, we have no idea. We've seen some kids bounce back. You know, they err on the side of positivity, but they won't give you any prognoses. Even now, if I ask, they say we have to wait and see. So those are the main takeaways, I guess.
Thank you, Gail. And I, again, want to thank you for being so candid and open about your experience, and want to echo a few of the things that you said for our families. I also sat through a cardiac arrest, not as long as Milo's, but Esme had a cardiac arrest. And to echo what Gail said about, you know, I didn't know that was what was happening. I didn't know for days afterwards. No one told me. And now I would know differently because I've been in this community and I have been through that experience, but, and I didn't know that I could ask questions. And so I think, you know, Gail echoed Karen's point about having these discussions beforehand, and the fact that, you know, the ground can change in the moment. And if you need to be asking questions to the extent that you can, but also to be forgiving of yourself as a human in these moments, that it is not, there is no right answer. And there always will be a, you know, a what if, as Gail said. There's just trying to do your best in the moment and be as prepared for any inevitability as you possibly can be. And with that, Liz, I'm going to ask you to hop on and tell us a little bit about your experiences with Will.
Sure. Yeah, thank you for inviting me to talk about Will. It's so important for me to continue to talk about him, and you will probably see smiles and tears at the same time, because that's what happens when I talk about Will, because he was just one of the in my life, and I'm just so grateful that I got to be his mom for 7.5 years. So he was, as far as how severely affected he was kind of middle of the road for the SCN community. You know, for anybody else, he was probably very severe in terms of his seizure activity and everything. But we had we had 2 different medications that worked pretty well for him for close to a year. So those were huge gifts to us, that we had some decent seizure control at various points in his life where he was so happy, and we were really focusing on therapy. He learned to walk independently at about 4 or 5. He learned all of his letters. So he was able to learn quite a bit. But when he was about just turned 5, we lost seizure control again, and we were never able to get the seizure under control again. And he lost the ability to walk independently. His memory was severely affected. His language was affected. And when that happened, we realized he was, well, not just plateauing, he was regressing. And we really, I don't know if it was ever an explicit decision that my husband and I made, but we kind of just decided we still took him to therapy, but I wasn't doing all the stuff at home as diligently as I used to. We just decided to enjoy him and make him comfortable and happy, and be present with him. And that's just one of the huge gifts that I'm so glad we made that decision, because you couldn't be anything but present with Will. Like he was really good with people. He remembered faces and he remembered names, and he just loved being with people. He's just such a sweet little guy and loved. I mean, one little story that I want to share with you is that, I would have been with him all day, but towards the end of the night, I was doing dishes in the kitchen, and he would be sitting on the couch with Michael, doing some flashcards or watching some Yo Gabba Gabba. That was his favorite show. And in the middle of washing dishes, I'd hear him say, "Huh, Mama." I'd seen him all day, but he just really he was very relationally connective and really wanted to connect with whoever was around. He was just such a sweet little guy. When he got the SCN8A diagnosis, we talked with his neurologist, and his neurologist recommended that he actually did talk with us about SUDEP, which, not a lot of doctors do. And so we talked about, probably good practice would be to just continue to monitor him with a video. It was a video and audio. It's like a baby monitor. So we said we feel comfortable doing with that. We've been doing that ever since he started having seizures. And we had actually gotten one of those Embrace monitors, seizure monitor. I didn't really understand what a pulse ox was. The reason being that Will always came out of his seizures. We never had to revive him or anything like that. So I didn't really think he needed a pulse ox. And then with the Embrace, we got the Embrace monitor, but then we heard from this group, that there could be a lot of false, this is still developing technology and it's not great, right? Hopefully we'll be in a better place in a few years. But there were a lot of false positives with any of the monitoring devices. And with Will, his sleep was already so disturbed that my husband and I made the decision not to monitor him beyond the little baby visual and audio monitor, because we thought, oh my gosh, what if it goes off all the time? We go in and wake him up. He won't go back to sleep. He already had so many sleep issues. And then the sleep issues can lead to, increased seizures the next day. So we made the decision not to do anything beyond the little visual and audio monitor. So summer of 2017, Will was 7.5, and he had just finished summer school. He'd made it to school every day that summer for the 4 weeks, which was pretty good for him, right? He was averaging about 1 seizure a week, which is, not great, but not terrible, right? That we felt like we could live with that. So he was kind of doing okay. That summer, we were working on developing a special needs trust with an attorney, kind of, in balancing long-term planning, but also trying to be present with him. And then on the night of July 16th, I don't remember it specifically, but I always said to him before he went to sleep, before Michael put him down, "Night, buddy, I love you." That's what I always said. Those were my last words to him. And I'm so glad that those were my last words to him. "I love you." He had to go in for a blood draw the next morning. He was on a medication that he needed to do that for. And so Michael and I went in to wake him up, and we knew immediately that he had passed. And we pretty much knew immediately that it was SUDEP. And it was very sudden. But he also I see what some of the kids in this group go through and the suffering. And none of us want our kids to suffer. And I'm grateful that his passing was very peaceful. Thank you for allowing me to share my story and share about Will. It's very meaningful to me that we keep on remembering him and by telling his story. So thank you.
Thank you, Liz. And thank you just so much for sharing him with us and sharing so openly. Again, all three of you. It takes a lot to stand up in front of people and talk about these things. I pride myself on being able to do that. And you guys have, all three of you, just knocked the wind out of me because the strength you guys have shown in sharing your stories is absolutely exceptional. And I do want to talk just about a couple of things, Liz, that you said that I think are really important and orienting, and that is, enjoying our children. And I think, we are all asked to work at an incredibly high level, day in and day out, in service of our children. And I absolutely fully endorse and support that. And at the same time, with any child, as Gail said, there can be a car accident, and anything in life can happen, as we all know. And what are the likelihood that we all would have children with these mutations? Anything can happen, and I think it is so important to remember that being present with our children, enjoying them, loving them, accepting them for who they are, is a primary goal for us as parents as well. And also recognizing that, I see Shelley is commenting that they have chosen not to monitor as well for similar reasons. And, decisions about what to do and not to do for our children are incredibly personal and incredibly specific to each of our children. And the right decision for monitoring or not, for one child is not necessarily the right decision for the other, maybe not the right decision for one parent or another. And again, I just want to reiterate that our goal here is to talk about these things because they are, and I see Tammy saying, this is incredibly hard. This is incredibly hard. This is incredibly hard. And we all are living it. And often I think we're living it and hearing these stories and asking these questions of ourselves, and maybe having some conversations in small groups with people who we trust. And really that's the beginning of why we're having this meeting today. And I want to mention that Gail came to me with the idea for having some of these discussions on the heels of Milo's arrest. And I think additionally in book club with Casey, these conversations are coming up all the time. I know we say we never really talk about the books in book club, and that's true. We talk about all sorts of things up to and including these kinds of discussions. And I really want to formalize that and make a very clear statement that as a community, these conversations can and should happen. They should happen in a non-judgmental way. We all are facing these things, and every single person on this screen I have talked to about my own challenges, as well as the challenges they were facing personally, for advice and support. And I think we have to remember that that's what we're here for, right? This support group is here for this. We are here as individuals. The volunteers at TCSF are here for this. And we're here to have these conversations with you, no matter how hard they get. And with that, I'd like us to have, move to have maybe a bit of a discussion here. And I want to invite people to talk in the chat if you have specific questions or general questions. And just mention we will be sharing resources in the support group after this discussion. So I just really want to open up some of the conversation here with, I guess the question I would put to all three of you as we let people join in the chat a little bit is, knowing what you know now, and recognizing that hindsight is what it is, what do you wish you'd known ahead of time? And is there anything that you would have done differently? And I'll let you guys decide who wants to start. Jump in.
Yeah, I can jump in. I love that Gail was saying like what ifs, right? Because we always look back and, even just knowing that I was going to have this conversation, Michael and I were talking about those what ifs, but they're really impossible questions, right? And they're impossible to answer. I will say that I have no regrets about the decisions we made. Very early on when I joined the Facebook support group, one wise mom, there were some questions. I think another mom had made some decisions about medication and her child was not doing well. And she was really berating herself. And another mom said, there's no right decision. We just don't know. These are all really, really difficult, if not impossible situations that we're in. trying to make decisions for our children. So the only right decision, and I'm paraphrasing her, I think she said something like, the only right decision is the one that you make out of love for your child. And I repeat that to myself. I would repeat that to myself when Will was alive and not doing well, suffering. But when I start to think about the monitoring decision, I repeat that to myself and I remind myself, we made that decision out of love for Will, right? We don't know everything when we're making that decision, but we only have the information at hand and our love for the child to guide us. And so I don't have any regrets. I'm so grateful that we balanced kind of being present with him for the last few years of his life with also kind of planning for the future and doing some therapy. I'm so glad that we chose to do that. My only thing that I would say is that because Will died so suddenly and we weren't expecting it at all, we had to scramble at the very end because we wanted to donate some of his tissue his brain tissue and skin tissue for SCNA research. So fortunately, Dr. Hammer was able to, he had some contacts at USC and was able to, that typically doesn't happen, but we were able to get some of his brain and skin tissue. But that's maybe the only thing that I would have done differently is just like, okay, we don't know when he's going to go, but I know that I want for his body to be able to help other children in this group. So maybe that's the only thing that I would have done differently. But fortunately, we were still able to do that with some help from this community.
Thank you, Liz. And I think that's a really important piece also of you're bringing up of how we can maybe better as a community clarify what we can do in that situation and what the options are so that people can, if they want to, discuss it in advance. And I think I want to highlight something that Shinzia is saying in reference to, thinking about the unknowns, as Gail said, that we don't know. There's always what ifs, and Shinzia is saying sometimes it's not up to us to ensure that they have the best day every day. If they're suffering and moaning all day, what is best day every day? What does that mean? I think there is a huge difference between the different phenotypes of SCNA Day. And I just wanted to highlight, I don't want to talk too much about my experience with Ezzy today, but she did have a pretty significant arrest at 3 months. And we did have a lot of questions about how much she would recover. And there was a lot of time in there that looked not good, like really not good. And there's no way to predict that she would be a 10-year-old who's telling stories with an eye gaze device. And there would have been no way to know had we not hung on and pushed. And so again, I think to go back to, Liz made the right decision for Will, and I made the right decision for Esme, and Karen made the right decision for Lily, and Gail made the right decision for Milo, because that's the decision. And it was done with love. And sometimes that means a lot of not so great days to get to the best days. And I think it often knows, you have to know that it's whatever you're choosing, as Liz said, from love is the right decision. I want to highlight also Casey's talking about an outpatient DNR, and maybe Karen, could you speak to that a little bit, and what that looks like?
Yeah, so like I said, the one that signed for our hospital, it also works like if we had chosen to do hospice care, it's the same form. And basically, if you ran into a situation where, and Casey and I were talking about this, where something happened at your home and you think they're still with you, and you call EMS, but by the time they get there, your child has passed, then you can hand that to the EMTs and they can basically pronounce or leave, and you can spend that time with your child, and they are not required to try and resuscitate or what have you. But in Tennessee, it's the same form. Every state may be a little bit different.
And I think that's really important to know, is like so many things, unfortunately, in this country, in the US, there are different rules in different states, and a great way to utilize a support group is to be talking to people who are in similar states, ask these questions. utilize, as Michelle is mentioning, palliative care to help talk through what the options may be. You know, palliative care is not end of life care, it's quality of life care. And that's a really important distinction. And Madison is mentioning that she has not had this conversation with her husband. And she says, I have to be the strong one for Mia a lot of the time because Chris can't handle seeing her suffer in the slightest bit. I may or may not be the only mom in this situation, but he's making progress with it slowly and surely. Anyway, my question would be, what happens if worse ever came to worse and the family couldn't agree on what to do? I think that is a very important question. Madison, am in the situation that you're in. I'm the one who makes all the decisions. And in some ways prefer it that way. But if, you know, to be questioned would be incredibly difficult. And so I guess maybe, Gail, maybe you could talk through a little bit of what kinds of resources. I know it sounds like you and Juan are very much on the same page, but as you've looked for resources and discussed with each other, and then also individually, you know, what have you used of our resources as a community to help clarify your decisions?
Sure. So, early diagnosis, and I know there's some research out there, but it's still very new. Expectancy, it's just too hard to estimate with a small population. But since we knew that probably the chance that Milo has a short life is quite high, already we're trying to accept that fact. And we both agreed from the very beginning that we don't want him to suffer. You know, there's no point if he's having seizures all the time and he can't make any progress, or, you know, a toddler wants to go and explore and put their fingers in outlets and, you know, he can't even try to do that. You know, he's now especially stuck in a chair basically all day long. Beforehand, he was a little bit better, you know, so we supported him as much as we could so that he could develop to the fullest that he could. And he did have seizures, so we tried to keep those at bay as best as we could. And the medication discussion is a whole other issue, you know, on what works best for every child, which I think always wraps each of us with a lot of anxiety on switching medications, or do we increase the dose? So that was also a lot on our minds. But we definitely both were on the same page from the beginning that we would not have him just suffering the whole time just so that he could stay with us, essentially. We didn't, and I don't want to use this term, but, you know, we were trying to tell ourselves we don't want to be selfish. And maybe it's not a selfish thing, it's probably a parent survival mode, you know, but we tried to just put our interests aside and just focus on Milo. And like, if Milo could talk and tell us how he's feeling, what would he tell us? So that thing, I think the support group, it's just so good that they're there. We as soon as we got the support group, we joined. I think that's the great thing, is that you can get answers faster than talking to your neurologist, at least just if you need something quick until you do get an answer from the neurologist or the nurse. You know, or like simple questions where you have to modify things that you would do normally for a child who's neurotypical. So, and just knowing that they're there, you know, in the hard times too, not just the good times, but the hard times. And, you know, just being able to share and knowing that you're not being judged for whatever decision you make. Because there's really no right or wrong answer, and it's hard enough when you're making those decisions, and the last thing you want to feel is that you're being judged for making a certain choice. We're all going to have differences. Some people will lean more one way or the other, and we just have to know that that's how it is, and we just have to support each other on that. So I think that's the big thing. So thankfully, yeah, Juan and I are on the same page, because that would make that discussion even more difficult. You'd have to somehow find a compromise. I'm a kind of mathy person, so you can like make a formula, where like there's a threshold where like if you reach a threshold, we both agree if it's really severe that we need to stop it, and then if it's really mild, we'll do our best to support them and keep them alive. And of course you're going to have the middle gray area, which unfortunately probably happens most of the time, but a lot of it is just the unknown. Hindsight is always 20/20. But and so you have to just
Can you hear me?
It's really echoey or something.
Yes, me or something.
sorry.
My AirPods failed there for some. All mentioned. I think our children all have different skills, different ways, see that they communicate.
Okay, I'm still hearing myself from the last thing I said. Yeah.
As
Maybe I'll just talk right now and see if I can.
Hillary, what happened with your audio? It sounds like Star Wars.
Hang on. Is this?
Casey's saying to refresh. Try refreshing.
Try refreshing. Thank you, Casey.
We're having issues all over the place.
Technical.
You're still a robot? Yeah, that's probably the best estimation of what she sounds like, a robot.
Can you hear me now?
Yay!
Everybody decided you sounded like a robot.
Okay. Well, I'm sorry. I guess we've had quite the tech day today, and I guess maybe this is, as we're nearing the end of our time, kind of highlights something that I guess I wanted to mention and that came up in our conversation is being human in these conversations. And when we met to plan for these conversations, we did a lot of laughing and a lot of crying and a lot of crying and laughing. And, we were remembering that things like Karen during that hospital stay being sent underwear by another mom in our community. And, that it felt weird to be giggling in the middle of this conversation, as it felt a little bit weird to be giggling in the middle of the state that Lily was in when that happened. But we are all human, and we are all under such tremendous stress as parents. And even just talking and thinking about these moments and these kinds of decisions, it's incredibly stressful. And I want to just reiterate, a couple of things as we draw to a close. And that first and foremost is that we're a community that's here for each other, and that you can seek out, if you don't want to be super public about something that you're grappling with, you can reach out to individuals, look for people who have similar locations or approaches to things, because there's nothing more difficult when you need to talk about hard, cold facts. The person who says, it's going to be okay, and if you need to hear it's going to be okay, there's nothing more difficult than the other thing. So you seek out what you need, and we have it all here for you. And And that includes me as a resource. I think, again, everyone on this call can speak to the fact that that is a true thing. If you reach out to me, if you need me. Gail and I did not know each other particularly well until Milo's cardiac arrest, and we spent quite a bit of time together talking and got to know each other. And it's an incredible blessing to have these kinds of resources and these kinds of relationships. And then the other thing I just want to highlight is, speaking up about our children's experiences and presuming their competency, and that they are communicating with us in the ways that they can about what they need. And our job as their parents is to do our best to honor that. I do want to give you guys, do you have any last words that you would like to add?
I'd like to say something kind of in relation to, when we first had to sign the DNR, both times that we signed a DNR, I reached out to individuals, specifically Liz and to Brittany Falls, who had lost her son, Jake. And I am forever grateful for them sharing their experiences. I didn't want them to tell me what to do, because obviously that is not what they're there for. I just wanted to hear their experience. And ultimately, I got amazing support and encouragement and insight that I could share with my husband to help expand our conversation. And I've had such amazing conversations with so many others in this community, hard conversations that I could not have with family members or friends who have no idea what we experience. And the key thing is, I've never been judged. And we had a discussion a few weeks ago that led to some of the things we talked about today. And I just kind of read back through the responses that people gave, and I was in awe of the support that our families receive from all of us. We say it over and over and over again, what an awesome community we have, and we truly do. It is not just our quick call to action, it is the support that we show one another, and we don't judge. And we should all be feel very blessed and be very grateful, and I know I am.
Thank you, Karen. I couldn't agree more. I know this has been, oh yeah, Liz.
I can jump in real quickly too. I think particularly the Facebook support group for me helped me feel like as soon as I found it, I was like, this is where we belong. We had searched for 5 years, and all of a sudden there was this community where I was like, as soon as I saw some of the kids in the videos, I was like, we belong here. So it helped me feel less alone in his life, but also in his death. Like, I love remaining connected to this group. It gives me a way to honor and remember Will and continue to talk about him. And so I love this community so much. Chinzia, you put in the chat that, I think we struggle with, like, are we being selfish, or do we feel guilty? And all these are just so human things, but you have to realize, like, we are all constantly being traumatized by these are really awful situations. So as much as you're able, just kind of try to let yourself off the hook and say you're doing the best that you can. We're just all thrust in these really difficult or impossible situations. So everything that you feel is legitimate, but try not to be too hard on yourselves. I think that's what I would say to the group. And thank you for helping me continue to remember and honor Will I love this community so much.
Thank you, Liz. Any last words, Gail?
Yeah, a little bit more like technical, but depending on the state, there may be different types of DNRs. So just check which ones there are. For example, in Ohio, we have 2 main ones. They're called DNR CC, which is comfort care. Basically, if your child or anybody goes downhill, they just make sure that they're comfortable. A DNR CCA is that they'll do everything they can, intubation, etc., until the arrest. But then for the arrest, they don't try to resuscitate. So just, at first we actually, when they did approach us, and I have to say, actually, I first I feel silly because I feel like I should know this, but I actually had no idea that there was such a thing as a DNR until Karen mentioned it in one of her responses to one of my posts during or right after the arrest. And that's how I first learned about it. And then when I had to make that discussion and decisions, or I should say we, Juan and I, when we were in the ICU, palliative care team is pretty on you about that. They keep bugging you like 2-3 times a day. Did you make a decision? Did you make a decision? And it's a little bit hard because you want to kind of like sit on it, you know. But anyways, we actually we decided on the DNR CC because at the moment it was really intense. He was, you know, sedated, paralyzed, and etc. And the ER main doctor, physician, attending physician actually came to us and said, "Are you sure you want this DNR and not the CCA?" Because he said if he gets a small infection, for example, from being intubated, we're not going to do anything to help prevent it besides just making sure he feels better. So those are one of those things like for the anaphylaxis, which is fixable. So, you know, so we actually changed the DNR that we had on Milo to the DNR CCA. And also I may have some resources. I have to go back and look from before for donation of tissue, because at the time we also were in the event that anything were to happen in the hospital, that we were more prepared for in case we did have to donate, because we would love to donate tissue in that situation to help out the community as much as possible. So Milo contributes. And apparently, at least with the pandemic, they have to have a COVID test within the last 3 days before passing, which complicates things because they usually only do the COVID test at admission. And you're not going to ask every 3 days for them to do a test. So that's just something to keep in mind that hopefully will go away with time. But yeah, I can share that link with Hillary and she can add that to the resources. I think it's just through the NIH, so it's one of the main hubs. Yeah.
Thank you so much, Gail. And I think that's really helpful. We will share resources in the support group. And on that note, I want to be mindful of everyone and just sort of bring this difficult and loving conversation to a close. I know it's been really heavy and it's on a heavy week. But I do want to highlight before we go that conversations like this also provide hope in a sense of community, and a hope that we are going to keep focused on all of us doing what we can to support this community, to keep our children as safe as possible and as comfortable as possible while we keep moving forward in gains for this community. And I do want to highlight that as difficult as the last week and a bit has been, let's not also forget that we have made some huge gains in the last week, gains that point toward a safer future for our community. And, you know, as many of you have seen today, it was announced that FDA has granted Praxis orphan drug designation for Prax 562 for the treatment of SCN8A. And this joins the pre-existing rare pediatric disease designation, and it gives us a lot of hope for continued advancement for this potential treatment for our children, as well as other potential treatments for our children that are underway. And we also enrolled nearly 100 SCN8A patients into the Citizen platform. And this provides a huge future data set for supporting research and drug development. And this is how we keep moving forward. We work and we push our partners to work and support this community in the most meaningful ways possible. And we show up as a community to show what we can accomplish together in our losses and in our gains and our wins. So thank you today to Karen and Liz and Gail and Heather for showing up to discuss so openly and engage so meaningfully about such a personal conversation. And we also have to thank our event sponsors. Our lead sponsor is Praxis Precision Medicines, and we are also sponsored by Neurocrine Biosciences. I want to thank Casey for hosting, and Megan and Shelley today for providing tech support. And most importantly, to all of you, all of our community members, for showing up to this space with your questions, your ideas, your insights. This is how the work is done for our community. So we will see you next week. Thank you, everyone. Bye.